Mass incarceration, as we call it in this country, is really a consequence of structural racism, ableism, and classism. We have also used incarceration really as a solution to our problems in this country of mental illness and substance use.
We, as a society, need to do a lot of work to improve the health and welfare of people who are incarcerated.
I think right now, based off of the infrastructure of the U.S. carceral system, it would be very difficult to come out rehabilitated.
We should be doing a better job of preventing incarceration and preventing the conditions that lead to incarceration.
Incarceration really has been a tool to house people who have disproportionate burdens of mental health problems, substance use, and as a result, also people with disproportionate burdens of chronic illness and infectious disease.
I think there were a lot of policy changes that wound us up where we are right now in a time of mass incarceration, starting with probably the deinstitutionalization of mental health facilities, the war on drugs, and then the tough on crime efforts.
Primary prevention is this idea that you prevent the problem to begin with. And in this case, the problem is incarceration. So thinking about, are there better solutions to treating mental health problems and substance use in the community? Homelessness. Secondary prevention is about reducing the impact of disease and also doing better prevention and screening. We think about cancer screening, for example. It's a great tool of secondary prevention. How can we screen those people and send them elsewhere? Alternatives to incarceration, alternatives to sentencing, again, to drug treatment, to mental health treatment.
Because incarceration is not the way to treat mental illness or substance use. The way to treat them is with the medical healthcare treatments that we have. Unfortunately, without those treatments, people end up in jail and prison.
And the last level, of course, is tertiary prevention, which is once a person has a disease, how do you treat it? So this is like a broken arm, you put it in a cast. And so this is for people who are in confinement. We're the fourth largest incarcerator in the world. Incarceration is a huge social problem in this country, and in fact is not really associated with the reduction of crime.
Admittedly, there's some people that regardless of underlying diseases, they've committed crimes and it's appropriate to incarcerate them. But then once they're in jail and prison, and this is still a sick population, we need to do the best we can to get them healthy, to keep them healthy, and to make sure that when they enter back into the community, which by the way, almost all of them do. Close to 95% of people who are incarcerated come back to our communities. So let's make them and keep them healthy so when they come back, they're healthy. They can be productive members of society, that they don't cause a drain on society, so they're not recommitting crimes. And also, so their health doesn't fall apart, which by the way, becomes an expense of society.
It is true that the carceral system often is seen as a place to store the people that the public does not want to see and to hide their problems.
We have a hard time convincing taxpayers and society that it's important to invest money and resources into the health and welfare of people who are incarcerated. And I understand that. If we close our eyes to the situation and just say, hey, great, they're locked up, don't worry about it, we're really not only not doing the right thing from a humanitarian standpoint, but even for Joe Public, who says, I don't care about these people, you have to care about them because they are going to get out, and when they get out, they are going to affect your life.
And I think the media hugely impacts the way folks that are incarcerated are viewed in a very negative way. And that's the way people imagine that the majority of folks are in the carceral setting, when that is really a very small number of people that are incarcerated.
It's really expensive to incarcerate people. So an opportunity that has sort of, reached across the aisle, so to speak, has really been to think about what is the cost of incarceration and how could you have community benefits, reduction in crime, which speaks to people, engagement in the employment sector. And the costs of doing those things in communities rather than using prisons and jails are actually far less. And so that has been an opportunity that has really spoken to people when it comes to incarceration policies and keeping people out of confinement.
The carceral system probably is one of the most costly investments that the United States has made. And I think there is a desire from both sides of the fence to want to decrease spending. And we would do that by investing into the social problems that lead to incarceration, in that housing somebody in a facility for years is very expensive.